To get the meeting started, we just got one function to perform, so if I can ask the board members to meet us at that Ottawa Public Health Board, so we can get a picture taken for our annual report. So if everybody can gather there, we'll start with that and then we'll come back to the meeting. Thank you. Well, good evening, everyone. Thank you for joining us this evening. And on that note, hopefully everybody had a great summer. The weather's been perfect, and it seems to be continuing on for the next couple of days before, I guess, we get some snow or rain starting on Wednesday. Just wanted to, like I said, thanks everybody for joining us this afternoon. We have a pretty light agenda, and work through that pretty quickly, I think, and go out and enjoy the evening again. So first of all, there are no ceremonial activities this evening. Roll call, Madam Secretary.
Member Chernyshenko?
Présent.
Membre Fleury?
Ici.
Member Kapoor?
Here.
Member Lakin? Member McKenney?
Present.
Membre Pinel?
Présent.
Vice-présidente Poirier?
Présente.
Chair Kadri?
Present.
Member Kakish?
Present.
Member Taylor? Member Tilley?
Present.
You have quorum, Mr. Chair.
Thank you very much. And regrets, we have regrets from Member Lakin and Member Taylor. Declaration of pecuniary interest. Any declarations of interest? Seeing none. Confirmation of minutes of the meeting of June 18, 2018, as well as the confirmation of minutes of the meeting of August 20th, 2018. Can we confirm those minutes? Confirmed? Thank you. Communications, there are 19 communication items that have been received and are held with our board secretary. That the board received these items of communication received. Thank you. Motion to introduce report, Vice Chair Poirier.
Yes. Be it resolved, the verbal report by the Chair of the Board of Health, the verbal update by Dr. Vera Etches, Medical Officer of Health, and the reports titled Supporting Our Community Through Applied Public Health Research, an update, next steps to support healthy aging in Ottawa, communications and stakeholder engagement at Ottawa Public Health, 2018 Operating and Capital Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, and Delegation of Authority contracts awarded for the period of January 1st to June 30th, 2018, be received and considered.
Is that carried? Carried. Thank you. Item 1, Chair of the Board of Health verbal report. We'll hold that item. Same with item number 2, the Medical Officer of Health verbal report. Item 3, supporting our community through applied public health research and update. There is a presentation for that item, so we will hold that also. Item number 4, next steps to support healthy aging in Ottawa. And again, we have a presentation, so we will hold that item. Item number 5, communications and stakeholder engagements at Ottawa Public Health. The recommendation is that the Board of Health for the City of Ottawa Health Unit receive this report for information. Is that received, or do we have questions or comments? Received? Thank you. Item number 6, operating 2018 operating capital budget quarter 2, Board of Health for the City of Ottawa Health Unit status report, and the recommendation here is that the Board of Health for the City of Ottawa Health Unit receive this report for information. If we have any questions, we do have Lou Flaberia here to answer any questions if you have. If not, can we receive this report? Received. Thank you. Item number 7, delegation of authority contracts awarded for the period of January 1st to June 30th, 2018. And the report recommendation is that the Board of Health for the City of Ottawa Health Unit receive this report for information. Is that received? Thank you. And final item, information previously distributed. Overview of recent provincial announcement with potential public health implications, and it's there, so can we receive that?
I will have a question about that one.
All right. Thank you, Dr. Cooper. So moving back to item number 3 for the presentation. Sorry, we'll go to the verbal reports first. So my report. Good evening, everyone. Bonsoir. Thank you for being here tonight. This evening, I would like to update you on the infection prevention and control labs at the Stittsville Medical Clinic, acknowledge staff changes and achievements at Ottawa Public Health, and look ahead to a new initiative starting with the Queensway Carleton Hospital. As you will recall, in July, Ottawa Public Health advised the community of an infection prevention and control labs investigation involving patients who may have been exposed to improperly cleaned medical equipment during minor surgical procedures at the Main Street Family Medical Center located at 1251 Stittsville Main Street. Although the risk was low, as a precaution, OPH recommended that patients who had received a minor surgical procedure of concern at the clinic between December 2003 and April 25, 2018, undergo testing for hepatitis B, hepatitis C, and human immunodeficiency virus, HIV. The Main Street Medical Center mailed letters to the estimated 4,600 affected clinic patients to that effect. Since then, OPH has received copies of test results for approximately 1,640 patients, which represents 36% of the patients who were potentially exposed to improperly cleaned medical equipment at the clinic. The investigation is ongoing, and more detailed laboratory analyses are to come. Based on the information currently available, there's no evidence that these cases of hepatitis B or C are due to the infection prevention and control labs at this clinic. The information available to date includes the date of initial hepatitis diagnosis, the date of procedure or procedures at the clinic, and other risk factors for hepatitis infection. I've asked Dr. Etches to continue to keep me informed on the results of this investigation so that the community can be kept apprised of the outcomes, including this board. Next, I would like to acknowledge staff changes and achievements at Ottawa Public Health. On August 20th, the Board of Health held a special meeting regarding the appointment of Associate Medical Officer of Health. The report considered by the board was carried and referred to Council. Council approved the appointments of Dr. Sarah Fennell and Dr. Trevor Arneson as Associate Medical Officer of Health and forwarded these recommendations to the Ministry of Health and Long-Term Care for final approval. Dr. Fennell and Arneson both completed training with OPH during their medical residency at the University of Ottawa, and they're returning to OPH part-time basis, filling an existing full-time vacancy. I'm pleased both of these physicians had a positive residency experience at OPH and are keen to come back. And at this point, it's my pleasure to introduce Dr. Sarah Fennell. Doctor, give her a welcome like we do. Thank you. Thank you, and welcome to Ottawa Public Health. I would also like to acknowledge recent staff achievements. This spring, OPH received the Somerset West Community Health Center's Community Organization Award in recognition of the role OPH has played in building a healthier and more connected community in the Somerset West neighborhood. OPH's leadership in the area of harm reduction programs and service was highlighted. Also this coming week, OPH's dental health program will be receiving this year's Community Partner Award from Southeast Ottawa Community Health Center. This recognition, awarded by their Board of Directors, acknowledges the impact of our dental programming in the community. Looking ahead to this fall, OPH will be working with the Queensway Carleton Hospital in an effort to facilitate transition from hospital to home for new mothers and their families. Each year, the Queensway Carleton Hospital provides care for 2,400 expectant mothers and their families through labor, birth, and postpartum care. The hospital also administers a universal screening which identifies families that may need more postpartum support. These families are referred to the Ottawa Public Health's Healthy Growth and Development Team, which focuses on optimal prenatal health, child development, positive parent-child relationships, and positive parenting skills. We know that support by Healthy Growth and Development Team is most effective when it becomes early. In order to increase the number of early referrals, OPH establishes a nurse liaison who will work directly with the Queensway Carleton team and patients. Papers. Queensway Carleton team and patients in hospitals to facilitate access to information and resources in the community. OPH hopes this will improve liaison with the community, with the Queensway Carleton Hospital care team, and improve access to services for mothers and families who need them. This concludes my verbal report. I would also like to congratulate the board, the Ottawa Public Health staff that are and have received awards this year. So thank you very much for everybody's hard work on that. And with that, this concludes my report. Any questions on my report, or can we receive it? Thank you. Now it's my pleasure to turn the floor over to Dr. Etches for her verbal report.
Thank you, Chair. J'aimerais vous énoncer quelques faits saillants de l'été et vous parler des activités à venir cet automne. So this summer, Ottawa Public Health was involved in Capital Pride Week, and at the beginning of the week, employees joined Chair Caudry in raising the rainbow flag to celebrate LGBTQ+ communities everywhere and to acknowledge the progress that still remains to be made. And later in the week, employees joined Board of Health, council members and the community in walking with the OPH float in the Capitol Pride Parade. This provided us an opportunity to celebrate the diversity in our community, inclusion, and to highlight Ottawa Public Health's Connect With Us campaign. Cette campagne fait la promotion du site santépubliqueottawa.ca et des réseaux sociaux et des médiatiques de SPO, qui sont des sources clés d'informations fiables et en matière de santé publique. Also in August, I had the opportunity to meet with Robin Martin, the MPP Parliamentary Assistant to the Minister of Health and Long-Term Care at the Association of Municipalities of Ontario's annual General Conference. Among other subjects, Ms. Martin was interested in our mental health initiatives, which start in the early years with the Healthy Growth and Development team that was mentioned by the Chair. I also highlighted how our mental health and substance use approach involves bringing multiple sectors and partners together to support people across the lifespan to promote health, prevent illness, and also the harm reduction program that helps connect people to treatment. I provided the parliamentary assistant with more information on our mental health work after the meeting, and I look forward to continued work with the provincial government. And further on the subject of mental health, I was pleased to participate and see Ottawa Public Health contribute to Recovery Day activities last weekend, where many partner agencies advertised their services and their support to people who are experiencing alcohol and drug addiction. Looking now to the fall, next week is Environmental Public Health Week, which gives us an opportunity to recognize our public health inspectors and other environmental health practitioners. This theme this year is called the Path Forward, which is recognizing the really evolving role that environmental health practitioners are facing and doing to contribute to emerging issues, climate change, among others. And for the 2018-19 influenza season, Ottawa Public Health will again focus on providing the flu vaccine to the general population through physicians' offices and pharmacy providers, as well as providing targeted outreach to higher-risk populations facing barriers to immunization. As in previous years, Ottawa Public Health will provide community-based clinics in areas with limited numbers of pharmacies and in areas well attended by families with young children and seniors. Ottawa Public Health will be offering community clinics, mark your calendars, between October 27th and November 20th, including clinics in several local hospitals. So OPH collaborates with community health centers and the community paramedic program to provide clinics for residents in group homes, in shelters, and in retirement home settings. Des rendez-vous pour les familles ayant des enfants de moins de 5 ans seront offerts tous les jours dans notre clinique de vaccination située à 100 Promenade Constellation, et il y aura des cliniques de rattrapage mensuel pour les étudiants. In addition, for this fall, as the board learned in April, there's a new protocol under the Ontario Public Health Standards which requires health units to offer vision screening for senior kindergarten children in school. And recognizing that this implementation will be phased in, this October, Ottawa Public Health will begin to pilot the vision screening in 11 area schools. This pilot will integrate vision screening with our existing dental screening so that both are offered at the same time. And we'll evaluate this and use it to learn and plan for further screening. Before October, as we get started, Ottawa Public Health is hosting a training session for 5 surrounding health units as well as our own to use the new tools and be prepared. So, Monsieur le Président, cela conclut mon rapport verbal, and I'm happy to answer any questions also.
Member Fleury.
Merci, Monsieur le Président. I only have a few questions, and it really relates to a month from legal cannabis. And I want to know if OPH plans to inform the public of, any measures or any assistance. I mean, I think my personal feeling is that the product will be legalized. Those who consume the product generally consume it now illegally. But for those who there's a lot of seniors, for example, that are concerned. There's a lot of youth that might be, well, now it's a legal product. What does that mean for me? So I wonder, as we lead into the month before, are there local OPH or even provincial health ads that will go out and informing the public in terms of some of the risk and things to know about the legalization?
Oui, merci pour votre question. So that is underway as we speak, and looking back over the orientation week in September, I want to go back and remind you, Ottawa Public Health is focusing on youth and making sure that youth don't start if they're not using. If they are using, that they use cannabis in a way that reduces the risk to their health, as well as making sure people know the signs of problematic use, where to get help early. And we are also looking at supporting people who serve youth, who work with youth, parents, to make sure they have the information to really make sure that that population is making informed decisions. So we've started already through the last months. We've had parent education sessions. We've brought school boards, police, many different partners together to make sure we're sharing common health messages. And we currently on social media have materials that are available, and we can make sure that the board is aware, has the latest messages that we're sharing to spread those further. But yes, we are doing that ahead of the launch. We expect there'll be more questions, more interest as we get closer and closer to the date.
Member Kakish?
Thank you, Chair. And just to pick up on Councillor Fleury's point with regards to the previous government had consulted or asked municipalities to provide their input with regards to public lounges and having the space to be able to consume that. Has there been any new developments with the new government in terms of the framework that's going to be set around that and the input that we've provided to them in terms of public smoking areas for marijuana?
Thank you for the question. We haven't had any direct communication from the Minister of Health and Long-Term Care related to their cannabis legislation. The information we provided previously stands, and we're looking for that opportunity if there is a consultation, to build on that and inform the new government. But to date, there hasn't been any change, any signal of a change. It's just on hold. Yeah.
Anyone else? Seeing no other question, can we receive Dr. Etch's report? Received. Thank you. Okay, moving on to item number 3, supporting our community through applied public health research is an update, and I welcome Dr. Robin Taylor, Associate Medical Officer of Health, and Amira Ali, Senior thank you. We'll speak to a PowerPoint presentation, so the floor is yours. Thank you.
Okay, hello, good evening. As the chair kindly said, my name is Amira Ali, and I'm the senior epidemiologist at Ottawa Public Health. I'm here with my colleague, Dr. Robin Taylor, who is the associate medical officer of health, and also is my, we call ourselves partners in crime, my co-lead on the evidence portfolio. Tonight, we're pleased to inform and advise the board on the role of applied research and evidence-informed decision-making at Ottawa Public Health. Our presentation will cover 4 main areas. Decision-making, we want to tell you that our decisions are based in evidence, including evidence that we generate locally, ourselves from local research. We also want to tell you that we have a mandate through the Ontario Public Health Standards to conduct research. Dr. Taylor will present an example showing the benefits of local research collaborations, and we'll talk to you a little bit about our independent research ethics board.
Amira, can you put your mic a little closer to you, please? Thank you.
Is it okay now? Okay. So as I mentioned in my previous slide, it is important that we make decisions informed by evidence. Using evidence allows us to ensure that our programs and services are sound and are of good quality, ensures that they are cost-effective and they are efficient, and that we use the most current and best practices available. This helps Ottawa Public Health to provide the best care for the community. And this rationale is reflected in the foundational standards of the Ontario Public Health Standards, which mandates the work that we do in public health. We are nurturing a culture of research and innovation at OPH. Our research, which is often conducted in collaboration with partnerships with local institutions, allows us to investigate our public health needs to best serve our local community. Through this work, we generate effective local interventions, and moreover, by collaborating with researchers, we stay relevant and efficient by sharing resources and expertise with the research community.
Ottawa Public Health collaborates with researchers to investigate local public health needs and to generate effective local interventions that serve our community. As you might have noticed from our report, there were several projects we could have chosen to speak about tonight. However, we decided to highlight one project where Ottawa Public Health is playing an important role in research. This project is looking into tuberculosis treatment. And in order to tell you more about the research project, I'll just ask for a minute to give you a little bit of information about tuberculosis, because it's not a typical infection. Most people who get infected with the bacteria that causes tuberculosis don't actually get sick right away. The bacteria infects the body and goes dormant or sleeping, and then it may activate later in life for some reason, and at that time the person becomes very sick with active tuberculosis disease and can often infect other people. So the time to treat tuberculosis is before people get sick, while the disease is still dormant, or as we say, latent. Standard treatment for latent tuberculosis is 270 doses of medication over 9 months. It's a long treatment. For this research project, Ottawa Public Health has partnered with a researcher, Dr. Gonzalo Alvarez from the Ottawa Hospital, and his team, who are investigating a much shorter treatment, 12 doses over a period of 3 months. The aim of the research is to determine if this shorter treatment is more acceptable and more tolerated by the people who need the treatment for latent tuberculosis. The more acceptable the treatment, the more likely people are to finish it, and the more likely people are to finish it, the more likely we are to prevent active tuberculosis disease in the future. Ottawa Public Health is playing a vital role in this research study by actively monitoring participants taking the treatment medication and sharing the relevant data back with the research team. These study results will likely influence latent TB treatment here at Ottawa Public Health at a local level, but also provincially and federally as well. So it's a project we're really proud of. To ensure that this tuberculosis research project, but also all other research involving Ottawa Public Health employees, learners, volunteers, or even data that could identify individuals, is conducted in an ethical manner, Ottawa Public Health has a research ethics board, which operates according to the ethical standards expected in Canada and laid out in the joint policy of Canada's 3 federal research agencies. This is the expected standard for conducting research that involves humans. And as you may remember from the report, our research ethics board is independent, it's a volunteer board, and the members bring a diversity of expertise, so we're really quite fortunate to have them. Into the future, we'll make sure that our research continues to be conducted according to the necessary ethical standards. But we also plan to increase opportunities for public health-focused evidence generation projects, from evaluations to research, with external partners. We're going to continue to access the National Collaborating Center for Methods and Tools, which is a federal agency that are helping to provide us and ensure that staff have the best available tools and methods to practice public health in an evidence-informed way. And we're going to continue to advance the provision of public health programs and services through high-quality scientific evidence. That's a generation of the evidence, using evidence which has already been generated, and making sure that when we generate evidence, we spread the news, we disseminate it to our peer health units and others. So in conclusion, Research at Ottawa Public Health is undertaken in partnerships with both academia and the community. We have a Research Ethics Board, which is a volunteer board that ensures our research involving Ottawa Public Health is conducted ethically. And the end goal of our any research conducted by Ottawa Public Health is to improve the health of the population or to improve the care of the community, which of course is keeping with our mission at Ottawa Public Health. Thank you.
Thank you very much for your presentation. Any questions or comments? Madame Poirier.
Thank you, Mr. Chair. Just a quick question. First of all, I was impressed with the breadth of issues that you have research ongoing, and also the use of a board is extremely important to preserve research ethics, so I commend you on that. My question was more as to how you establish the areas of research. I know in many cases it's driven by other partners, but are there any that, do you have a priority setting exercise internally to determine where you should research next?
Thank you so much for the question. So we're quite fortunate at Ottawa Public Health that, as you said, we do have collaborations with external partners, and through academia is where the bulk of our research come. They have access to granting agencies and are able to partner with us. We do have a small fund internally to seed innovation within Ottawa Public Health employees. And those research projects, it's very exciting to be on the committee that looks at the applications for those research projects. They are most often driven and bubble up by people in the front line who see a need. They're often quite applicable to the Ottawa context. So what's happening in Ottawa? How could we do something better in Ottawa? Let's pilot it, let's study it, and make sure that if we scale it up, it will work. So we do have a small amount of funding for internal projects, yeah.
Also, in addition to what Dr. Taylor said, through our epidemiologic analysis and surveillance activities, sometimes issues come up, and we would either partner with other health units or other researchers that are working in the field to conduct research on some of these areas that we found.
Anyone else? Seeing none, can we receive this report? Received? Thank you very much, Dr. Taylor and Amira, for your presentation. Moving on to item number 4, is the next steps to support healthy aging in Ottawa. And we have Erin Solowiski, Program Manager of Chronic Disease and Injury Prevention. She'll speak to the PowerPoint presentation, and she'll be accompanied by Jillian Conley. Welcome.
Thank you. Good evening, bonsoir. My name is Erin Soluski, and I'm the Program Manager, as was mentioned, for the Chronic Disease and Injury Prevention Unit. I'll be presenting our Healthy Aging Report tonight. So similar to the rest of the country, Ottawa has an aging population. In fact, there are even more seniors living in Ottawa than children or youth. And this population is increasing. The greatest increase will be in those aged 85 and older. This group will double by 2036. This population is also increasingly diverse. Almost 1 in 6 older adults identified as a visible minority compared in 2016 compared to just over 1 in 10 in 2001. And older adults are also living longer. In Canada, the life expectancy at birth has risen significantly over the years. We also know that older adults are significant contributors to Ottawa's community. Older adults contribute to society through volunteering, participating in community events, caring for others, and many are still employed. While older adults are living healthier longer, the prevalence of disability and chronic disease increases with age. 1 in 4 older adults aged 65 to 79, and increasing to over 1/3 of older adults over age 80, report having at least 4 chronic conditions. In addition, we know that there are health inequalities. Some older adult groups, such as women, LGBTQ, Indigenous, newcomer, and older adults with disabilities, are more vulnerable to poor health outcomes. While older adults are involved and engaged, the increasing prevalence of chronic disease and health inequities for some groups is concerning. In Ontario, the healthiest 50% of older adults account for only 6% of overall annual spending on healthcare. Our goal is to maintain or improve the quality of life for older adults in Ottawa. So we've been doing work in this area for many years. We have supported the Older Adult Plan. In the area of falls prevention, we've provided the Better Strength, Better Balance program. We've increased the public awareness and of protective factors to prevent falls, and increased capacity of older adults and service providers to prevent falls as well. We have also worked with the Champlain Local Health Integration Network and other community partners on the Aging in Place project to deliver OPH programs in 11 Ottawa community housing buildings. This project supports older adults to live healthily and independently in their own homes. And finally, we've to reduce social isolation, OPH provided a home visiting service through the Community Connect project and developed the Mental Health Caregiver Guide. But we know there's more to do. So OPH is reviewing its healthy aging programming with a goal of better serving Ottawa's older adults and expanding collaboration with community partners. We are looking to expand our health promotion initiatives in key areas beyond falls prevention. We have identified brain health, falls prevention, caregiver resilience, and supporting an age-friendly community as 4 key areas to improve the quality of life of older adults. So just to go through each of the 4 briefly. So for brain health, we know that dementia is the leading cause of dependency and disability among older adults, and is one of the top 3 causes of death in Ottawa among those aged 65 and older, and that the risk of a dementia diagnosis roughly doubles with age every 5 years after age 65. So we'd like to prevent or delay the onset of dementia and keep older adults healthier longer. We will focus on raising awareness of health-promoting behaviors to preserve brain health, early detection and diagnosis of dementia, and exploring awareness, education, and training for dementia-friendly initiatives, and explore opportunities within the city. The second focus area that we're looking into is caregiver resilience. An estimated 29% of Ottawa's population are in fact caregivers, and they experience burdens and do need support. We'll work with partners to assist caregivers to navigate resources more effectively, support caregivers to build their own self-care skills, and promote advanced care planning to reduce stress for caregivers and loved ones. The prevention of falls and related injuries remains a public health priority. Every year in Ottawa, approximately 1/5 of the older adults living in private homes experience a fall. And falls can result in chronic pain, reduced mobility, loss of independence, and is important to address. OPH will continue to offer the Better Strength, Better Balance program in partnership with the LIN and Recreation, Culture, and Facilities Program Department, and explore approaches to offer falls prevention education and training in the community. And finally, the 4th focus area that we're going to be looking at is around age-friendly communities. Making communities age-friendly is believed to be one of the best ways for older adults to lead healthy and active lives and stay involved in the community. An age-friendly city has policy, services, settings, and structure to support and enable people to age actively. We will continue to support age-friendly initiatives with partners, like the redesign of an outdoor space at a seniors building, and also we'll look at exploring other policies and opportunities to work with partners to support other age-friendly community initiatives. We're also piloting the Healthy Eating Active Living Guidelines for retirement homes, and will continue to work on the Aging in Place project. So moving to next steps, we will continue to support the older adult plan through reviewing the city's consultation findings to build into our OPH healthy aging plans going forward. And we will continue to consult and engage with our partners on the development of an OPH healthy aging strategy and updating of that strategy. There are many key stakeholders in Ottawa focusing on various elements important to older adults, and we're keen to understand the current context and leverage collective impact to improve the health of older adults in Ottawa. Thank you. Merci.
Thank you very much for your presentation, and to the board. We do have a public delegation on this item, so we'll hear from the public delegation before we go to questions of the presenters. So may I call Carol McDonald to come and address the board, please?
We should say. Okay.
Carol, thank you for joining us. Welcome, and you have 5 minutes to address the board, please.
Thank you. Thank you for allowing me to present this evening. I'll be presenting on behalf of the Ottawa Council on Smoking or Health. We wish to congratulate the Board of Health for promoting healthy aging in our community and for educating landlords on smoke-free policies. The report states that 18% of seniors in Ottawa have chronic obstructive pulmonary disease, and that ischemic heart disease is one of the leading causes of death among seniors. We're also very aware that secondhand smoke causes exacerbations of chronic obstructive pulmonary disease and ischemic heart disease, and it continues to have deadly consequences in our community. As I've stated before to this board, the Ottawa Council on Smoking or Health continues to receive complaints from seniors with chronic obstructive pulmonary disease, heart disease, and cancer who live in multi-unit housing and who are living this very situation, being exposed to secondhand smoke. For the majority, they cannot comprehend the situation they found themselves trapped in, and they feel really helpless to do anything about it. With many seniors downsizing and moving into multi-unit housing, we see this as a public health problem. We see this public health problem escalating. Therefore, we are recommending that the Ottawa Board of Health add educating seniors about health risks and consequences of secondhand smoke, and also to support seniors who are in desperate need of 100% smoke-free housing. We would like to see this added to the older adult plan. 1 month from today, cannabis use will be legal. We are once again urging that this board take steps to protect seniors who live in multi-unit housing from cannabis products, and indeed to protect all of us by harmonizing the city's bylaws to include cannabis smoke and vaping. For instance, right now there is no law, it's on pause, and in any apartment building, if the law doesn't come in, and this doesn't even include smoke-free buildings, this is just ordinary buildings, you can walk into the lobby, the laundry room, the elevator, the hallways, and smoke cannabis to your heart's content, and it will not be against the law. Clean air should be the gold standard for maintaining health for senior populations and all populations. Thank you.
Thank you very much, Ms. McDonald. Any board have any questions or comments to the presenter? Okay, thank you, Member Kenny. Anyone else? No, thanks very much, Ms. McDonald, for coming in this evening. And the questions to staff, I'll turn it back to Member McKinney.
Thank you, Chair, and thank you for coming out. I just want to address the concerns that you raised with staff. I represent an area that over half of the residents that I represent in Somerset Ward live in multi-residential buildings, many of them seniors, and I hear about this all the time. I've heard about it mostly seniors, often, sometimes parents with young children in multi-residential buildings who have to contend with secondhand smoke. And the notion now that it will be, it could be cannabis that they will, have their children and themselves exposed to is really quite disconcerting. So I do want to just turn it back over to staff and just ask for, what public health in terms of moving forward. Today we're talking about aging in place and the older adult plan, and what is it that we can do as a Board of Health, and what are we doing to ensure that we are educating seniors, obviously, but doing what we can to move away from allowing any type of smoking in public spaces.
Thank you, Councillor, for that question. And one of the pieces that we are aware of as a result of, further to Councillor Fleury's question earlier on about cannabis smoking, was the gap in the legislation, as Ms. McDonald pointed out, and it's something that we're looking to work with landlords in the City of Ottawa to be promoting smoke-free and vape-free places within multi-unit dwellings. And that's one of our priorities that we'll be looking to move forward with this year, and then continuing discussions with city partners to see where else we could be making adjustments as a result of the new cannabis legislation.
So if I could just ask what that looks like in reality. So if we get, and I know that I've had public health reach out to landlords before, but what does that look like on the ground? If you've got a landlord that's allowing smoking that is either in a unit or in this case with cannabis in a public space, what exactly are we able to compel at this point? Or are we just going in and educating?
And I'm happy to see if Omar wanted to make a comment about our legislative capabilities within that. As a result of it being a private residence, from a legislative perspective, there's not, we don't have a huge amount of leeway to do that, and that's why we're working with educating residents, landlords, and we have seen some successes of some discussions with developers prior to them developing that they actually create a whole space that's smoke-free. And one of the things that we're seeing is even trying to find the lessons learned from our work with the Ottawa Community Housing. So a number of years back, we worked with them to be trying to get all their units to be smoke-free, and then there's some clauses in there about grandfathering. And so how do we support individuals to be reducing others' exposure, but also the individuals who are using cannabis or tobacco on their own to be maybe moving to quitting? And so these are kind of some of the elements that we're working with within the units. And so we try to find where are we seeing the complaints, where are we able to make some progress, and where we're able to make some impact.
So unlike back in the early 2000s when public health, Ottawa Public Health took a real lead in the province in terms of moving ahead on no smoking bylaw. What I guess my question is to legal. What I'm not sure that I want to wait for the province in this case to do the right thing. What are legally, what are we able to do to move forward here?
While Omar's thinking about that, we have provided the public health perspective on cannabis, including in multi-unit dwellings, to the province. We're expecting that regulation very soon because they need something in place within 4 weeks. So, I think the provincial level regulation will inform what, if any, gaps continue to exist at the local level. Now, we are, as you say, we're not just waiting for the province. We are working with all of our city partners because there are many different departments that are impacted by the legalization of cannabis and cannabis use. So we're working up different frameworks and aspects to protect the public. So that work's currently underway across multiple departments.
Okay, thank you.
Member McKinney, can you repeat the question for our legal?
Yeah, sorry. I was just asking from a legal perspective what the City of Ottawa, Public Health, can do to move forward in terms of legislation, our own bylaws around non-smoking in multi-residential units and buildings that, I don't know that we want to be waiting for the province at this point. I know we're going to see within a month what their regulations are, but if they're not adequate to, providing the type of health needs of our residents, what can we do to move forward?
Yes, through the chair, in respect of common areas of multi-residential unit buildings, there are existing laws that prohibit smoking, and it's expected that come October 17th, smoking of cannabis will also be addressed through those provincial laws. But as the member mentioned, there is a gap in that the legislation that's currently, let's say the legislation that may be subject to further amendments, but the legislation that's currently that received royal assent with the previous government does not address smoking within the actual residential units. On that point, the ability of the city to enact municipal bylaws is limited to the extent that there's a limited authority to restrict smoking in a private dwelling space. So that's certainly something that staff can review further, but to date, the efforts made in respect of smoking within the dwelling units have largely been directed not in a legislative manner, but the steps that have been taken are largely policy-driven. For example, encouraging landlords to adopt a smoke-free policy rather than having a provincial law or municipal bylaw that restricts smoking within dwelling units. So there's broadly speaking, a legal impediment in restricting the ability of individuals to smoke within a dwelling unit.
Thank you. And I'm not criticizing the work that's been done at all, but, I think my understanding is we've got Ottawa Community Housing, Homestead, and two others maybe on board. So we've got the vast majority of our residents living in multi-residential buildings that are not even seeing a grandfathering and a phasing out of smoking. So I just want to put that on record that it is a concern, and I'll continue to think about that.
Thank you, Member McKinney. Member Chernyshenko.
Yes, thank you. I did have questions about another aspect of the report that was raised, but I do just want to follow up quickly on this. And so, can you clarify? I think what I understood then is that a government cannot impose those sorts of smoke-free restrictions in a private dwelling. We can't do that in somebody's house, for example. So why could we in their apartment? But the owner of a building might have a policy that in order to rent in that building, you must abide by a smoke-free policy. Is that the distinction?
Through the chair, yes, that's correct. And not only rental buildings, but also condominium corporations. There's bylaws and other, essentially the same goal would be to, by policy or by bylaw require, condo bylaw require that residents do not smoke in their units. Yeah.
Right, thank you. So that clearly the work to be done then is engaging with the owners of the buildings or the condo corporations to adopt those policies, I guess. On something different in the report that you raised about aging in place, I hear so much from residents, in particular of my ward. I'm sure it's the case in many parts of the city, particularly where real estate prices and home prices are going up so much, and therefore the tax amounts that residents are paying are going up in lockstep or almost in multiplication with that. That we have many people, in a sense, being priced out of the home that they already live in and the neighborhood that they live in and always did, and wanting to stay there. That was the subject of a seniors luncheon that I hosted, and we had some city staff and people from age-friendly Ottawa come to that. It's very clear it's an issue for a lot of people. There are some innovative tools that I've heard about in other countries and other places. I'd be intrigued whether public health staff have explored having younger people be, in a sense, long-term tenants in a home as part of some kind of a partnership with an aging, usually single person who may get sort of physical help with things in addition to rent. Finding ways to convert buildings, so that the older buildings, so that they might have multiple dwellings or rental dwellings. I don't have the specifics of many of those. I'm just intrigued when I hear them. Is public health doing any research in that area and kind of coming up with best practices that could be shared with, ultimately, perhaps through counselors, through city staff, to these kinds of aging seniors who, as I say, want to age in place, but clearly need either financial help or physical help to keep doing that?
If Jillian would like to add, but maybe I'll just get started. There is a program similar to what you're mentioning in another city in Ontario, where it's connected with the university, and it's young adults living with older adults. And the program, at least from what I've seen, seems really promising, and it's something that we could look at exploring mechanisms to have a similar program here in Ottawa. And then the other one around converting buildings to multiple dwellings. These are all ideas we can absolutely look into and explore.
Thank you. I guess wherever we can take best practices and not reinvent wheels, particularly if we've seen successful cases, that would be valuable. So please do keep up that research and keep Council and the Board of Health informed of what you find. Thank you.
Okay, will do.
Thank you very much, members. Chernyshenko, Member Kapoor.
My question was related to Councillor Chernyshenko's question about what we were able to do. I recall about 2 years ago, before the Smoke-Free Ontario Act 2017 was introduced, we asked that staff and legal look into what gaps there are and what further Ottawa could do if the Government of Ontario didn't proceed. And as it turned out, the Government of Ontario at the time did proceed. Now that we're back in those, we've taken a pause on that. I'm wondering if that should be if we should resurrect that review and just see the results of that. And I'm not sure how much of that review at that time covered what we could do to encourage those kinds of policies in multiple unit buildings. So I'm wondering if we can ask staff if they can find and bring forward for our information the results of that review that was done back probably 2 years ago.
Yes, I just as we've kept you informed about the provincial, changes, we would be coming back on these subjects to inform the board about, the results of any legislation that comes forward and what we see as potential opportunities or needs that remain.
Okay, I'm assuming that so what we did 2 years ago was we asked that staff look at what gaps are there in the municipal bylaw and where could we proceed if the provincial government didn't move forward. We're now no longer able to assume that the provincial government is moving forward. So I'm wondering if we can just get not even an update, but just see what information was gathered at that point. If I've tried to look for it, I can't recall seeing it, just so we have a starting point to know where we may need to move forward. The problem with this is taking one step back is that it can delay things for quite a while. So I'd rather we are able to move forward as soon as we can on this issue.
Yes, we can certainly provide the board with more information about that.
Thank you. Member Tilley?
Just wanted to offer more a comment and then maybe a question on this this research into seniors and some of the comments. I think it's fantastic that we're, as Ottawa Public Health, extending ourselves in that area. I sat down after a shift, a regular volunteer we have at a place like the Ottawa Mission. He comes in every Monday, and we sat down after a shift and chatted. I had no idea this gentleman was 89 years old. And as active, as engaged as can be at 89, I think we probably have another good 10 years at least coming out of him. And it's something reflective of what I've seen, of course, in my years with the food bank and with the Ottawa Mission, is it seems to be engagement. I noticed some of the terms here: independent, productive, engaged citizens. So I'd just encourage the staff to continue, our communications department, if anything, to continue to reach out to seniors as we seem to be doing. It's quite a difference. I've worked with seniors outside of my job over the years, and there's quite a difference with social isolation, those who sit in their condos or their apartments watching television all day long, versus the social inclusion piece that we can reach out. So if we continue to communicate to groups like, I'm thinking, Volunteer Ottawa, and let's face it, the seniors are the backbone of volunteerism in the city of Ottawa, right across this country. They're already out there, but I think for those who may not be, I think the spirit of volunteerism, keeping them engaged, is good for us all. It adds to, and then down the road here, we were earlier talking about applied public health research. I'd like to see that on seniors who are engaged in their communities in many activities versus those who aren't, the effects of dementia, Alzheimer's, the effects of the expectancy of life of those who are engaged. You know, I'm fortunate to have my parents at 88 and 86, and my dad just stepped down from the Lions Club of Cumberland after all these years, you know, and I think that's part of why he's still kicking up and contributing. So I think it's great that we're looking at this active piece of keeping seniors engaged.
Thank you. Anyone else with comments? Member Poirier?
Just a couple of quick points. I sit on the Change Foundation Board, which is an offshoot of the Ontario Hospital Association, and they've done an awful lot of work about caregivers and supporting caregivers, so you might want to reach out. And secondly, at VON, we have a lot of adult day programs. So to echo Peter's stories, an 82-year-old gentleman who's retired from the federal government, who still downhill skis, gets to drop off his wife who has dementia to an adult day program twice a week, and therefore he stays healthy too. So a lot of those initiatives go way beyond the patient, the client himself or herself, to benefit the whole family. So I think those initiatives are really, really important.
Thank you very much. Anyone else? Member Kakish?
Just a quick comment and feedback to staff to say thank you for the Better Strength, Better Balance program. I hear from seniors all the time. We have it at the Rideau View Community Center in Chapman Mills too. They love it, and all sorts of different, we have South Asian, Chinese, they all get in there and they do it. It's nice to see the diversity of various seniors in those pockets. I always get a lot of positive feedback about that, so keep up the good work.
Thank you.
Anyone else? So it's just a message back to the staff, the communication back to the board going forward is important. And also the fact that in terms of engaging the seniors, not only through their own network, but through any other access and other partners that we can achieve that, I think is very important. So thank you. Thanks to the board. Can we receive this item? Received? Thank you. Okay, we got the last item, which is the information previously distributed that Member Kapoor wanted to hold. It's the overview of recent provincial announcement with potential public health implications. And Member Kapoor has put a motion forward, so I'll turn the floor over to Member Kapoor to introduce the motion. Oh, I see. Okay. So because that item is not technically on the agenda, can we ask the board members to support pulling that item up to the agenda and then dealing with it. Is that carried? Thank you. Member Kapoor.
Thank you, Chair, and thank you, colleague members. I move, whereas implementation of the Smoke-Free Ontario Act 2017 was paused on June 29th, 2018 by order in council, be it resolved that the chair of the board write to the Premier and Minister of Health and Long-Term Care of Ontario, urging that the Government of Ontario implement the Smoke-Free Ontario Act 2017 without further delay. As we've seen, we were all operating under the assumption that this act was going to be implemented as of, I believe, September 1st, or July, as of July 1st, sorry, time flies, as of July 1st, and that was put on hold by the order in council. The act harmonized and brought up to the same standard as tobacco, e-cigarettes, and vaping products, as well as cannabis. So we had a nice floor, and it would have provided much less confusion, as some of which we've heard about earlier, and some of which even sidetracked our discussion on healthy aging. It also affected our work in Ottawa in terms of this would have settled a lot of the issues that are now going to come again, as we heard earlier, in terms of 1 month from today when cannabis gets legalized. There are, if you look in our communications package, there are already 6 public health unit boards that have written to the Premier and Minister of Health urging that this be taken, a step be taken. I think for our benefit and for the benefit of our residents in all of Ontario, we should also be on record as supporting this. It will save work for our staff if this actually goes through, and will make it easier for us to promote the health of Ottawa and Ontario.
Thank you very much, Member Kapoor. Anybody have comments on the motion? No? And yeah, I will, working with Dr. Etches, write that letter to the Minister in terms of supporting the request on this motion. So thank you. So can we carry the motion? Carried. Thanks very much. Okay, moving on to motion to adopt reports. Member
Yes,
Party.
thank you, Mr. Chair. Be it resolved that the verbal report by the Chair of the Board of Health, the verbal update by Dr. Vera Etches, Medical Officer of Health, and the report's title, Supporting Our Community Through Applied Public Health Research and Update, Next Steps to Support Healthy Aging in Ottawa, Communications and Stakeholder Engagement at Ottawa Public Health, 2018 Operating and Capital Budget Q2, Board of Health for the City of Ottawa Health Unit Status Report, and Delegation of Authority contracts awarded for the period of January 1st to June 30th, 2018 be received and adopted as amended.
Is that carried? Thank you. And motion of which notice has been given previously, I see none. Motions requiring suspension of rules of procedure, anybody have one? None? Thank you. And notices of motion for consideration at subsequent meeting, and I don't have any in my possession for that. Inquiries and answers, anybody have inquiries? Seeing none. Confirmation bylaw, Madame Poirier.
Thank you. Be it resolved that confirmation bylaw number 2018-5, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of September 17th, 2018, be read and passed.
Is that carried? Thank you. Adjournment? Carried. Thank you. Thanks, everybody. And our next meeting is regular meeting on Monday, 19th of November, 2018. Thanks, everybody.